Welcome back to This is VANCOLOUR. Last month, Vancouver police raided DULF, the Drug User Liberation Front, for operating a compassion club that was purchasing illicit drugs from the dark web to test and distribute at cost to its members. Now, DULF had received provincial funding, so critics have been asking why taxpayer money was spent on purchasing heroin, cocaine, and meth off the dark web. Here to talk about it, we're joined by a co-founder of DULF and the host of the Crackdown podcast. He's Garth Mullins. Garth, so nice to meet you in person, finally.
Yeah, it's good to be here, Mo.
I got to ask you, so DULF got raided for running this compassion club. For people who don't know what that is, can you explain exactly what a compassion club is and what it does?
Yeah, it's when a group of people that all need something together, like say in the early days of HIV/AIDS, people organized together to get themselves meds when those meds weren't available, to pool their money and buy meds. People did the same thing in this city for years with medicinal cannabis, to buy weed together when that was still illegal. So it's an old idea.
Right. And so how much taxpayer or public funds were being used by DULF in this operation, in the Compassion Club operation?
None. All the money that went to buying drugs, buying meth, coke, heroin, no public taxpayer money went to that. It was all private donation money.
But DULF was receiving provincial funds for other things.
Sure, yeah, to run an overdose prevention site and to do drug testing. These things are activities that other non-government organizations are funded to do. The government pays different community organizations to run these kind of health services on their behalf. And DULF was no different than other groups in that respect.
So I've seen a lot of critics basically conflate the two things, saying, hey, listen, DULF is receiving money for these operations, but also private funds or not, they are buying drugs off the dark web. Can you see where people might have an issue with that this organization that is publicly funded is buying drugs off the dark web? I
mean, there are some politicians that are just outright saying, we are taking taxpayer money and buying drugs with it. And that's just not true. It's BS. We've clarified it many times to some of those politicians. They don't care. It's a nice, sexy thing to say to voters.
Politicians sticking to their narratives.
That's
Garth.
Right, yeah. Can't believe it.
Speaking of a politician, I want to read a quote from BC Premier David Eby. He said after the raids of DULF, he said, "It is unfortunate because they were providing essential life-saving work, but they, DULF, were also breaking the law, which we will not tolerate." I have my own thoughts on that, but I want to ask you, why didn't DULF go through legal means to perhaps create a safe supply program where they could effectively distribute these illicit drugs to members of their Compassion Club?
Well, first of all, it's nice of the Premier to acknowledge that we were doing life-saving work. Why didn't we try and do it legally first? We did. We didn't set out to be outlaws. We sought permission from Health Canada to do a small, to basically give us legal standing so that we could do this service legally. It would give us the ability to, negotiate agreements with pharmaceutical companies to, get the heroin or whatever from a pharmaceutical manufacturer. But Health Canada said, nope, no way. So we were sort of forced. We had no other choice.
And what do you feel when you hear the Premier saying that? Because he's acknowledging that DULF is doing life-saving work, but then he's saying, well, the rules are the rules. And you would just morally think that perhaps life-saving work would trump any sense of rules or what is right or wrong.
No, I mean, it's frustrating, right? Because they've gone and arrested my friends for saving people's lives. So that's really outrageous. Also, this is something the government should be doing. We're doing his job, saving lives, protecting citizens. That's something that government's there for. That's what we pay our taxes for. And lastly, he's in the state. He leads the state. The state makes the rules. So change the rules. And then finally, if we all obeyed every single rule all the time, we would never get anywhere in history. This is how come we have safe injection sites, because people broke that law first and set up unpermitted safe injection sites. This is how we had needle exchanges. It used to be illegal. When I started being a injection heroin user, back when I was a teenager, it was illegal to give out syringes, and I had to share syringes with other people. So people broke that law. I mean, people break unjust laws to twist the arm of government to move history forward. And we're not the only ones who've done it. People who are oppressed, exploited, otherwise screwed over, they have done it throughout history all over the world.
Absolutely. And I want to explain why I chuckled there, because what you're explaining is so simple. The logic is so sound. And I find it's really frustrating when you have, the BC chief coroner, or you have Dr. Bonnie Henry coming out and saying, hey, we should change the police act, or we should change these rules, or we should make these exemptions, and they get ignored, right? So that's where I do find it frustrating. I think it's a very excellent point that you bring up in terms of he can make the rules, so why doesn't he?
That's right.
One rule that did come about earlier this year was decriminalization. However, I just feel like since the passing of decrim, we've almost seen a recriminalization with Bill 34 saying that drug users can't use drugs in public, or perhaps even if they're high in public, they could be criminalized for that. We definitely see this push against safe supply. Do you feel like we are being regressive in terms of our drug policy, where there was perhaps some hope at the start of the year?
Yeah, I mean, it's too bad because decriminalization was only just beginning and we were already seeing some good results. There was a 76% decrease in the amount of people being arrested for simple possession. So less people who were just holding a small amount of drugs, who were just drug users trying to survive the day, less of those people are winding up in jail. And if you're not going to jail, then you're better place to go and actually get treatment, or especially you're not getting released from jail with a different tolerance and maybe overdosing. So right there, that's just one statistic from the province that shows we were on the right road. But politically, they lost their appetite for it. New Premier David Eby, and they just seem to be backing away from all aspects of harm reduction, from safe supply, from decrim, from the whole lot of it.
And let's talk about that, because there are a lot of people saying like, hey, we've tried the harm reduction experiment. We've done safe supply. And you know what? Maybe it's fine to keep people alive or not to die instantly from doing drugs. But really, we need to focus on getting people into treatment, even if that includes involuntary treatment. What's your response to that narrative? Because I am hearing it a lot from politicians and from people in the media.
It's a fair comment. I mean, what we've tried harm reduction studies and pilot projects and very small things. And we found from the evidence gathered there that these initiatives are really, really effective. Like safe injection sites are very effective at avoiding overdose. In fact, they're 100% effective. They're fantastically effective at saving people's lives. We just don't have enough of them. They're just not around the province. Safe supply is also really effective, but only about 4%, only about 4,000 of the 225,000 people that could need it are able to access safe supply.
Wow, so really, less than 2%.
Yeah, right. Better math. But what we're seeing is these little pilot projects showing what's possible, but then we never roll them out. We never expand them to give them a full shot at being successful. So people might say, oh, we've tried harm reduction, it doesn't work. We haven't. We've done a few experiments to show what's possible, but then we've never rolled it out. We've never done the next step. So really, we're in a bad spot right now.
Garth, I appreciate your time tonight. You are so good at making this accessible. I think it's a very important file, and I do hope that more people pay attention to what you're saying and really pay attention to this crisis. So thank you so much.
Thanks a lot, Mo. I've benefited from having a safe supply of opioids myself for many years. It's why I'm alive. It's why I'm here talking to you. I just want that for everybody else. So thanks for having me.
Absolutely. Thank you. Folks, that was Garth Mullins of Crackdown Podcast. We will be recording some overtime with Garth, so be sure to find This Is VANCOLOUR wherever you listen to your podcasts. Now, after some business, Vancouver police also recently raided a trio of magic mushroom dispensaries, which were back up and running only a few days later. But I thought psychedelic drugs were illegal, so Kyla Lee will be here to help explain their legal status up next.